3 years ago, Jessica's complex regional pain syndrome became so critical that her parents were told by doctors in the United States that she was near death. Out of desperation, her very last hope to live was to become part of the Ketamine Coma study. She went by air ambulance to Monterrey, Mexico, in hopes of a life-saving treatment. The journey that was expected to be a few months of treatment ended up being a 2.5-year roller coaster filled with many twists and turns, including a cardiac arrest.
All right, so today is February 17th, 2012, and this is a very important video we're doing because 2.5 years ago, roughly 2.5 years ago, you came to me dying. And anybody watching this video, they have to watch the first video. They're not going to get anything out of this if they don't. So it'll be available to everybody to take a look at. Now, so 2.5 years ago, as you came here, you were wasted down to skin and bones. You had ulcers up and down, particularly on the right side of your face, gaping ulcers, which actually were getting worse by the day.
Can you give me that? I have to show them a picture on the video.
Yeah, all right, that's all right. You can show us.
Yeah, I'll show you what I had when I came.
And you can right here we have a camera. You can show it on there.
Okay, perfect.
And not only that, but you had the inability to tolerate any type of light. Yeah, there you go, right there. You had the inability to tolerate any kind of light, any kind of sound. You had dark glasses on, and you had these active noise cancellation plus earplugs in your ears.
And even that didn't cut it. Everything was still probably 30 times louder than it should.
So there was anybody that had what we call central pain amplification, sensitivity to any type of stimulus, it was you. Now, this also came in a kind of an interesting context. The context is you had basically two neurological disorders going on at one time. You had the chronic Lyme disease,
Right.
which was a result of a tick bite, which occurred, I think, was roughly about how much before? About a year before, or something.
About 2 years before the RSD.
Yeah, right. And then that evolved into the RSD. Now, I think, Jessica, since you're so knowledgeable about both diseases, why don't you tell us how the people want to be educated? How do you tell the difference between chronic Lyme and CRPS? Because you've seen both types of patients.
Okay. Well, I think in my case, the main difference is that my RSD was triggered by infection both times. The first time it's when I had mono, and the second time it was from Lyme disease. And I've met a lot of patients being in Mexico 14 months, a lot of RSD patients, and a lot of Lyme disease patients I've talked to and met in various doctors' offices and clinics. And the difference with Lyme disease is that when I was first sick, they thought I just had like neuropathic pain secondary to the Lyme infection hijacking my nervous system and causing my brain to shoot out all these crazy signals to my brain. But the thing with the Lyme disease, it's more like they complain of more of like a joint pain or an arthritis type pain, or more like fibromyalgia, aches, pains. You just general can't get out of bed, like the worst flu you've ever had times 10 type feeling. RSD is, you can't mistake RSD for Lyme disease. It's burning pain. It's pain to even a touch like this that feels like if your hand touched a barbecue and you just can't retract it. It's constant, it spreads, and also it's more, for me at least, when I was just sick with Lyme disease, it was generalized throughout my entire body. When I started having the RSD symptoms again, it was my right leg and my right arm that were predominantly worse. And then that eventually spread through my left side, my stomach, my face, my back, everywhere. But it was predominantly my right side when I had the RSD.
Right, and I think you're making a critically important point. In other words, RSD tends to be asymmetrical.
Right.
But not always, but you can count on it.
Yeah.
The Lyme disease, like fibromyalgia, tends to be both above and below the waist.
Yeah.
And there's just generalized sensitivity all over.
Right.
And yes, the joints are involved and all that. But
the allodynia is a really key thing for the RSD too, because I've never once seen a Lyme disease patient lying down, like unable to tolerate their covers, or unable to wear pants, or unable to wear shoes, or unable to be hugged. It's more of like an internal pain that's always there. No outside influences really change it. With the RSD, cold temperatures affect it, hot temperatures affect it, clothes affect it. I couldn't wear clothes before I went to Mexico. I couldn't be touched, I couldn't be hugged, I couldn't anything.
Right.
So that's the allodynia, the burning pain to touch. It's specific.
Okay.
Yeah.
All right. So, and that was a very good demonstration of the difference between the two. Now, let's go back 2.5 years. You go down to Monterrey, Mexico for the 5-day ketamine coma. And when Dr. Cantu first saw you, he said what?
He looked at me, and he looked at my mom, and he looked back at me and told her to come in the hallway with him. And he told her that it was the worst case he had seen. I mean, when I got to Monterrey, I went by private air ambulance, and they used, on that air ambulance, every narcotic, every sedative, fentanyl, Versed, maximum doses, just to get me landed.
They actually ran out of them.
They actually, yeah. They had just enough to get me to the hospital. When I got to the hospital, I woke up and I was on the stretcher and I was just screaming in burning pain. My ulcers were spontaneously bleeding. I was shaking. I was in seizure. Dr. Cantu had to give me, I think it was 15 milligrams of midazolam just to get me upstairs. And he said that he had not seen, I don't think he'd ever seen anything like me. He kind of looked at me like I was an alien. With the sunglasses and the headphones, but he took my mom in the hallway and just told her.
They were both in her room for 5 minutes.
Yeah,
you could imagine them walking into.
I couldn't even tolerate the sound of him talking to me, so there wasn't much to say.
They both said to me, we need to speak to you out in the hallway.
Yeah.
And
So what did they say?
Well, Dr. Cantu came to me and he said, you know that you could lose your daughter here in Monterrey, Mexico. And are you ready and willing and able to face that fact? And I said, quite honestly, she has no life now. And as far as we're concerned, we're ready. We want to put her in the coma. And we just hope and pray that God does the right thing and she gets pulled through. And it was really a miracle. And we thank God, we thank Dr. Cantu, we thank you, we thank all the doctors, everybody there, because it really was
Okay,
wonderful.
so she goes into the coma, okay, and then guess what? Now she gets a pneumothorax, right?
Yes.
And for her, that's a real serious thing. She's debilitated. She's probably got some real immunodeficiencies, and that's a life-threatening situation. You put the chest tubes in. But during the coma, you notice a couple of things. Right, you notice the ulcer started drying up, didn't
Yeah, I
it?
can show you that.
We have
Yeah.
photos. I took a lot of pictures when we were in Monterrey. And you can see, definitely
Yeah.
see
This
the
was day
difference.
1 in
Yep.
the coma.
Yep.
And then each day, my mom practically watched them vanish before her eyes. That was in the coma. That was what my stomach looked like with the feeding tube and
Right.
the lesions during the coma. But you can see, I mean, there's less. They're
That's
starting
right.
to scab over.
That's right.
The hospital. It's another day. This is, you can see they were,
Right.
drying.
So it takes about 3 days to really see the effects, and most of the patients, they come with the gaping ulcers to see the healing that takes place. Okay, so you have that done, and the other thing that happened during that period of time, there was some improvement
after.
in the allodynia, I believe. You could touch her. You couldn't touch her before, right?
Right, I was able to rub her back, which was something I
Yeah,
could
she was
never do
untouchable,
before.
right?
So there was small improvements that you could know post
Okay.
the first coma.
Okay, all right. So we're not out of the woods here. So anyway, Marcus down the road, just briefly, what happened next? That they didn't put you in a ketamine coma, but they had to put you to sleep, basically had to do with Tegretol, correct?
Yeah.
And for whatever reason, they gave you Tegretol, and you got into Tegretol toxicity, correct?
Yes. Yeah.
And part of that appears to be blindness. So now you got somebody that's got CRPS and now is going blind.
I also had severe amnesia during this time. For 3.5
yes.
weeks, it's important to mention.
Yeah,
it's
I
important to
right.
mention.
I
that.
didn't even know my mother. I didn't know anything about my life. I didn't know who I was. I didn't know I was in Mexico, why I was in Mexico. All I knew was I had these, they were healing at the time, but these sores and this, I just didn't know anything.
Right.
My sisters would call me on the phone.
Yeah, I called her and
Yeah.
she picked up and I was like, "Hi, Jessica, it's your sister," and she was like, "Mom, I think that's I called her
I
mom."
didn't understand the concept of
And
she was
"Oh,
talking to
phone."
me on a cell phone.
Yeah.
In my mind, a person must have
She
been in
thought
the
the person
phone.
lived
It
in
was
the
like,
First of all, we need to introduce this person over.
Oh.
Your sister is
Okay.
Catherine, right?
Hi.
And this is Mom.
Mom.
Okay. Okay. So they, fortunately, as a result of, or as it just turns out that your vision returned after being put to sleep. I mean, again, this was not with ketamine. This was just with propofol. Okay.
Right.
Because they didn't know what else to do with you, right?
I was in so much pain at that point, and I had a lot of infections, and for me, infections is what starts this whole nervous system
Right.
malfunction problem. So that just mounted. The lesions were all back. They were spreading down my leg. They were spreading up my arm, and that coupled with not being able to see. For 3.5 months after the Tegretol problem, all I saw was like static vision, as if you turned on a TV and it was just static. So that coupled with the pain, coupled with
Some
17
people call that
days.
snow.
Snow vision?
Snow.
Yeah. that
Snow
could
on
be
the
a part
TV.
of
I
it.
guess it was like that.
Yeah.
Yeah.
Static
Visual snow.
So that was before your
Yeah.
time when we had to watch black and white. Okay, so then you then eventually you ended up getting really sick with infection. I believe I'm correct on that.
Yeah.
And you ended up you went into an arrest, didn't you not? You went to a
Yeah.
cardiac arrest, did you not?
Yeah.
Well, yeah, it was
And,
more
and then
respiratory.
and then and then they had to do what they have to do, which means probably put you on a ventilator, which means they have to intubate you.
That was way after this, though. This
Yes.
was in
I
December.
know.
Yeah.
We're kind of zooming ahead here a little
okay.
bit.
Yeah.
And and so you ended up getting intubated, and they said, well, if we're going to do all that, let's just go ahead and give you ketamine, okay?
Yeah.
Right.
So they gave you the ketamine, and you got some things here that show us what it was like. That was what what'd you call that? The big M word?
Mir-
That was the big miracle coma, really.
That was the miracle coma.
Yes, because I mean, you know, the lesions were
happened?
coming back.
Yeah.
The pain was awful. She really went into septic shock. 105 fever, 0 white count. So
When I had the
She called it
7-day
on the floor.
propofol coma for my eyesight problem, I was 17 days without sleep at that point. I was hallucinating. I was just beyond control. So he had to bring me back down, re-intubated, put me to sleep. But I woke up with my eyesight back. But that didn't solve the RSD problem. I think it's important to mention because it does speak to the effectiveness of the ketamine. I had a coma with ketamine where lesions healed, movement came back to my left leg. I was able to be rubbed and tolerate more lights. There was some
Start to eat
improvement.
again.
So this is so everybody
Yeah.
understands, and I think you're making a very important point.
Yeah.
And that is putting somebody to sleep with any kind of
Propofol.
anesthetic. If it's not ketamine,
ketamine,
it
it's
isn't going to
not.
do any good.
Not for
I woke
RSD.
up
Not for
with
the RSD.
not for the
Not for
RSD.
Not for the RSD.
No.
It's
Yeah.
only with the ketamine that you put
Yeah.
somebody to sleep that you get the results.
Right.
And that's an important point. I just want to underscore that.
Yeah.
Now, all right, so you go through the second ketamine.
I wake up from the second actual coma. I have my eyesight back, but I'm still in the hospital. I think 7 more months after that. I was finally discharged from the hospital after 10 months.
Okay.
And I got home. We rented an apartment because I wasn't able to fly back yet. And Hurricane Alex hit Monterey. And this is the hurricane.
Okay.
There was a mountain back here, but you can't even see it.
We're in Florida. We know what hurricanes are.
I know, but this
Okay.
was a
But
bad
not
one.
Monterey, because they
This,
hadn't
this
had
was their
one
first one in 22 years.
All right. Okay.
So during the hurricane, I had my medical port accessed, and I got a really bad mold infection that went septic.
Okay, well, we're going to
So-
zoom ahead here on
Okay.
this. Okay, so you go in for your second ketamine
Yes,
coma. Okay,
yes.
and so you can just march us through the
Okay.
pictures here.
Well, this is when I was first getting the infection, and my
Okay.
arm was starting to have
Okay.
the pain again.
Okay.
It was getting discolored, coming back. This was a rainbow after the hurricane.
Okay,
Okay, this was my arm before the second coma. I was back in the hospital,
right.
and it just kept getting worse, and the pain was getting worse as well. But then one night back at the apartment, I felt like I couldn't breathe, and I was shaking and sweating, and I had 105 fever. And at that point, I had to be rushed back to Hospital San Jose again. When I got there, my white count was a 0.6. My body was overwhelmed with infection.
All right, here's the bottom line. The bottom line is that you were dying.
Yeah.
You're dying.
Yeah.
I mean, you're not. If you lived through this, it would be a miracle.
That would have been a miracle.
All right, so just march
this
us through the
is
photographs
down in the
during the days you were in the coma,
is
just to
down in the operating
demonstrate
room.
the healing of the comas. Okay,
This is down in the
we're going to
operating
zoom
room.
ahead here.
This
a
is
little
in the
bit.
coma.
Yeah.
This was my arm in the coma.
Well, she coded on the floor, so it was an
Yeah.
emergency.
Yeah. All right. So what day is this? The first day in the coma?
No, this was.
Okay. So you can. The point is, you'll see the ulcers drying up during the
Yes.
second coma,
Yeah.
and then finally, when you came out of it, show us that picture.
Well, the thumbs up.
There you go. Everybody see that? Can you see that? All right. Good.
Yeah.
Yeah.
So there's a happy camera. So that's the miracle. That's the thing that turned everything around.
That was the
Yeah,
turning
there was.
point.
I mean, we wanted to do a second ketamine coma before that point because we felt like it was our only way. But at that point, I was so immunocompromised,
Yeah.
and Dr. Cantu said, if I put you in another coma, you'll die.
Yeah.
And God kind of made that decision for us that night when both my lung popped and filled with 5 liters of fluid. I couldn't breathe, and I was actually intubated in my hospital room, coded on the floor.
Right.
I had no blood pressure, no pulse. My temperature was 91 degrees. I was dead. A dead body is 91 degrees.
Right.
I
Right.
was dying.
Okay,
Yeah.
so now what we need to do, I just wanted people to get an idea of the path, the path that you went through.
Yeah.
That's now we're you went in there. You're 24 now. You went down there. You were
21.
21. Yeah.
Yes.
Okay, So, and how much weight has she gained over?
Okay, well, remember, she doesn't stand, so we've never really been able to weigh her except in a hospital bed that they can weigh her.
Sure, sure.
And then they have to take off the blankets and all. But when we went down there, she was probably 85 pounds.
Yeah, she was nothing. Yeah.
Now, I lift her, so you have to remember, I know how much,
Yeah.
and I'm saying now she's at least 115 pounds.
Yeah.
She's probably gained 30 pounds in 2.5 years.
Yeah. Okay, and she's eating now, and she doesn't have that light sensitivity she had before.
No hyperacusis,
No,
no light
none of
sensitivity.
that
She
stuff.
can
We watch
eat.
movies together.
Oh,
Yeah.
no seizures,
No,
no
I have
horrible
not had a
burning
seizure
pain.
since
Right.
the first coma.
Okay, so you ready for your functional testing?
I am.
All right.
Okay, stop.
That's 1.6. Do another one here.
Stop.
1.6. One more. Uno más.
Stop.
1.6.
Spanish now too.
I'm starting to breathe the air. You think you're
It's contagious.
Muy bueno.
Okay.
Stop.
1.4.
Stop.
1.3.
Stop.
And 1.5. First thing I want to do here, Jessica, is I want you to keep looking straight ahead, okay? And I want you to take 2 vertical fingers in your mouth. This is called the vertical finger test. See if you can get 2 fingers in your mouth, okay? Very good. Now, you remember, before you went into the ketamine coma, you couldn't do that.
No.
It was just way too
It was
painful.
hard to even get my arm up to there, but I had pain all in here, and I had really horrible headaches before the coma. Headaches that were like as if I had smacked my head against the floor, and it was throbbing. My head was in a vice. It felt like I had an ice pick being driven through my left temple into my right. And whenever I would even open my mouth, I would feel that all in here, all
Right.
up into here, and
Right.
all the way around back in my neck.
Right, and you were really sensitive on that left side of your face, weren't you?
Yeah.
So now you can push on your face. You don't have any pain there?
No.
No? All right, good. Now, next thing I want you to do now is take that right hand, put it behind your head if you can, and I'm going to ask you if you're having any pain. You have any pain when you do that? Okay. That was obviously impossible before.
This was the arm that had all the lesions.
That's right.
and the worst.
Your right side was always the worst, okay? And of course, that's where you got bit by the tick behind your leg, isn't it? You got
Yes.
that big old target lesion back there.
Yeah.
Now, the next thing we want you to do is do the left hand behind your head, please. Atta girl. Good job. Any pain when you do that?
No.
Okay. Next, I want you to take that right hand out in front of you. Open and close it as fast as you can. Atta girl. Any pain when you do that?
No.
Okay. Now, the other hand, do the same thing using your thumb. Move. That's right. Good, good, good. Any pain when you do that?
No.
Okay, very good. Excellent. Now, we're going to draw our attention down to the lower part of your body, and that is down to your leg here. And I've asked your mom to help me out. I want you to see that black mark. That mark is where she crosses over into the allodynia, in other words, the road burn. Mom, start up above and work your way down very slowly. Now, you got to do stroking. Here's how you do it. You go like this, light strokes. That's how you really magnify it. Okay, when you get down there, tell her to stop.
Stop.
Right there. Okay, now come across this way. Again, light strokes. Close your eyes. Tell her to stop when she gets into it.
Stop.
Okay, good. So you still have some allodynia, and that's about it down there, isn't it?
I can move my legs.
Yeah. We're going to get to that in a second here. But the point is, we're going to use that as a marker going forward to see how you're progressing in that
Yeah,
regard.
all
Okay.
of my residual that I would call RSD symptoms,
Mhm.
probably 85% of the symptoms that I had when I went to Mexico 2.5 years ago are gone.
Yeah.
The remaining is all in this lower right
Sure.
leg. And
Right,
it's mostly
exactly.
movement and
Right. That's why we're focusing a lot of attention on there to establish a baseline at
Right.
this point in time. Next thing I want you to do here is I want your right foot, I want you to rotate your ankle for me as best you can. Obviously you had no motion whatsoever there before, right?
right.
And see if you can wiggle your toes at all now. There you go. You got some movement there. You had none of that before.
Right.
Okay. Now do your left, please. Rotate your ankle. You couldn't do that before.
No.
Wiggle your toes. Okay, and hitchhike back to Mexico.
Hitchhike back to Dr. Cancun.
There you go.
Hooray!
There you go. Okay, excellent. Good job. Now, look, you've been debilitated
Yeah.
for a long time. You cannot do weight bearing right now. You're not ready for that. You got to build the bones up. You got to build up the muscles and so forth, because the risk of you re-injuring yourself. However, I am going to give you my opinion. My opinion is you need to get into heated pool exercises. You've watched my lecture before on measuring exercise tolerance and all that kind of stuff, right?
Good hangover, bad
Good hangover, bad hangovers. You know the script,
I do.
okay? So that it applies to you, but you got to do it in baby steps. You're going to start real slow and work your way into it. I think it's really, really important in your situation. As far as going forward, that would be my best advice. The second thing I'm going to tell you, if you do happen to have acute pain, and Mom, you know the difference, right?
Yes, we know the difference.
If she gets into acute pain, that has to be treated aggressively. You have to have surgery. They can't mess around with you. They have to give you aggressive. If it requires narcotics, opioids, and so forth, you have to have them, okay?
Correct.
All right. Now, next thing I want to do here is I want to turn over here to Catherine. Catherine, you've been through this whole thing, right?
Yes.
Okay, so tell me what that trip's been like for you as a sister.
For a while, I lost my sister. She was basically just, a shell of a person living in the basement of her house and then living in a hospital in Mexico. And then after the comas and after everything Dr. Cantu and you, she's back and she's better than ever. We have such a closer relationship than we've ever had in our whole entire life after all of this. And I feel like God's just given us another chance. And I can actually hug her again, which is huge.
Yeah, right.
For a while, I couldn't hug her.
Tell them what you're on a break from right now to regain these
I
memories.
actually took a year leave from school so that I would be able to spend time with her and just like reconnect after I didn't get to see her for so long. I can't take my eyes off her. You notice that? I'm just like looking at her over here too. But it's just amazing.
Great. I'm going to turn over here to your mom. Mom, for the record, let's be clear.
Yeah.
She is the most difficult, the most challenging, the one that's been down there the longest. We've had some others like Spengler, Lindsay Spengler. I thought she was going to set the record, but Jessica said she had.
Donna Dorn, the winner.
Yeah.
I remember you said, you said, well, you're at least going to be down there
3
at least
months.
3 months.
Yeah.
Well, it
He
turned
lied,
into
14.
2.5 years, but I think actually, even though Jessica had infection, the reality is her having to stay down in Mexico was really a saving grace.
Yeah.
And it's hard when you're in it now, it's hard to look at things when things go wrong. It's hard to look at those things, but in retrospect, everything that happened really did happen for a reason, and it was stepping stones, small steps, huge advances, as Dr. Cantu says, towards the ultimate goal. We received a miracle in Monterey. I can't say enough for Dr. Cantu, Dr. Luigi, Dr. Rainbow, everybody there. I don't want to mention everybody because I'm afraid I'll forget somebody.
Sure.
Thank you also because you were the first small step for us getting to Monterey. But really, I have my daughter back. I can laugh with her. I can cry with her. We can smile, watch movies. It's a new life. I will say it's not normal as it was before. It's a new normal. And I really do feel that this treatment, even though we know it is a study and the whole difference between treatment and study and all, but I really do think that this should be an option for people like Jessica that have exhausted every other option. This should be made available for everybody.
Right. Now let's turn over here to Jessica. You know what? You got a second home down there in Mexico. You made a lot of friends. As a matter of fact, you didn't speak Spanish before you went down there, did you?
No.
Now you can speak Spanish, right?
Ahora puedo hablar español.
Okay.
Sí.
And I know that you established a godfather down there, right?
I did.
Yeah,
Dr. Cantu he's my hero. He's my savior. This little bear right here is actually named Niño Luigi Pach Cantu, and this little bear was with me in every coma, in every hospital, in every procedure. And I mean, I know 14 months was longer than I ever expected it would take to be down there, but like my mom said, getting stuck, if you'll call it that, with Dr. Cantu was the biggest blessing that's ever happened to me in my life, because the dedication, the wisdom, and the compassion that he has for us suffering from RSD, and just the knowledge that he has in what to do next, the next steps to take, and he never gave up on me, even though so many times I gave up on myself, and I just thought that I would never get better. I thought I would never go home, and he didn't think so either. He would actually used to tell me, I do his accent pretty good, he used to come in my room and go, "Oh, Jesse, you can't stay in Mexico forever." And you can't stay forever. You're going to have to go home to your family. But today, Dr. Cantu, I wear a green shirt in your honor.
Yes.
And I love you, and I respect you, and I just thank you for giving me this chance to have my life back. Que Dios te bendiga siempre, and tú es en mi corazón. I love you. You're my hero.